Hello everyone, and malapit na po tayo mag-good evening. Thanks for joining us today. It's a Tuesday, and mostly nag-Q&A po tayo or ask Dr. Anna over the weekend. Kaya lang, from last weekend, which was Halloween po, and ngayon pong Tuesday, we have the last weekend, nasa Manila po tayo, so we've been very busy. So para ho masagot na natin at para hindi po mag-build up yung mga tanong, let's do an Ask Dr. Anna Q&A po today. Naka-white po ako, naka-black yung background ko. So can we ask for a pink background on the Q&A, please, para maging masaya naman. So I am Dr. Anna York Bondoc. Our program is called Libreng Konsulta po. Nagbibigay po kami. We try to answer your questions, mostly about internal medicine. We are live on YouTube, Facebook. Bago na po kami sa TikTok. So please put your questions below. We will pick up po the questions from 2 weeks. Medyo delayed nga po kami. So 2 weeks questions. All right, so let's start. All questions welcome. Kung hindi ko po naman kaya, I will let you know.
From Miss Madiger Madad. Good afternoon, Doc. May I ask how many days should I be getting or receiving COVID vaccine after I got shot in tetanus toxoid? I mean the interval days before to receive COVID vaccine.
Okay. Okay, naintindihan ko po yung question. So basically, nagkaroon po siya ng tetanus toxoid and siguro nasugatan, went to the ER, got a tetanus shot. Ngayon, ang tanong po niya is when to do the COVID vaccine. Actually po, sa totoo lang, pwede kong sunod-sunod talaga yan eh. Pero I guess after a few days of the tetanus shot, pwede na pong magkaroon. Halimbawa, tinawag na po kayo na LGU, ano po, after 2 days, magpalipas po kayo ng maybe 48 hours just to totally make sure na wala pong kayong naramdaman from the tetanus shot and then go na po rin si COVID shot. Okay? Kung talagang, halimbawa, eto lang balik. So, tetanus shot, maybe 48 hours para just to clear totally the tetanus, then magpa-COVID na po kayo. Pero, I would like to, baliktarin natin yung issue. Halimbawa, papunta ka sa COVID, nabakunahan ka. Pag pauwi, na ano ka, nasugat ka sa marumi, when should you have your tetanus shot? That afternoon po na kayo po ay nasugatan. At assuming na COVID kayo, no, pauwi na sugatan, yung hapon na yun magpa-tetanus na po kayo. Kung nauna naman po si tetanus, you can wait 48 hours and then go for the COVID. Kasi po, ito COVID is not an emergency. Like, but tetanus is an emergency. So, hindi po pwede. Actually, tetanus is about, siguro more deadly pa than COVID. So, definitely po, if you had a tetanus shot, you can wait 48 hours and then have a COVID shot. Pero kung may COVID shot kayo, tapos may nangyari po, and then you need a tetanus shot, nung araw na yon pwede na po. Okay? Ikaklaro ko lang yun
Malinaw po, Doktora. From Miss Regine.
Okay, good.
Doc, good afternoon. Pwede po bang magpabakuna ang may diabetes at konting creatinine?
It's creatinine po, no? Yun po is, kung may konting creatinine, diabetes po, no? We all know diabetes. What is the meaning of konting creatinine? Ang meaning po noon hindi po normal ang kanilang kidney function. Why? Because creatinine is taken in the blood po. That's a sign of kidney function. Kung mataas po si creatinine ng konti, therefore may problema na po ng konti sa inyong kidney function. So yes, you need to have, hindi lang po pwede, but you need to have a COVID vaccine. Kasi po, as I mentioned before, kidney disease and diabetes, those are comorbidities po. What's the meaning of comorbidities? Pakisulat lang, comorbidities, para malinaw. Ang meaning po nito ay mga sakit na pag kayo po, na meron na ho kayo talaga. And then, nadapuan po kayo ng COVID, magiging mas grabe po yung COVID nyo. Or magiging mas grabe po si diabetes at saka yung kidney. So, what to do? Pabakuna na po. Okay? As soon as possible.
From Miss Leonisa Luis. Hi, good morning, Doc Ana. Ako po si Leonisa Luis, 24 from Cagayan de Oro City. Doc Ana,
Ma'am, napuputol po yung sinasabi nyo. Let me read it na lang. I'm sorry, I cannot hear it. Leonisa Luis, good morning. Ako po si Leonisa from Cagayan. Ako po ay may 2 anak. Ano ba ang tanong niya? Doc, yung nararamdaman ko po sa aking ulo ay palaging sumasakit at sa aking ngipin
Sorry, Doc. Yes.
Sorry. I really cannot hear anything. Ng ngipin tapos ng log. Pabulok na po ang lunas kong ito. Headache at toothache. Ma'am, patingin niyo naman yung ngipin niyo. From a dentist, don't be afraid. Tama ba yung interpretation ko? I'm sorry, I can't read it so well.
Hindi
Headache
po,
plus
Doc.
toothache. What is the question?
Sabi po niya, Doc, ang nararamdaman ko po sa aking ulo ay palaging sumasakit at ang ngipin ko po ay sumasakit. Parang ganun po. Tapos nalalaglag daw po yung mga buhok niya.
Headache and toothache. Ano pa bang hindi malinaw doon? Headache and toothache, di ba yun?
Parang nalalagas po yung mga hair niya, Doc.
Ma'am, ang dami niyo naman problema. Headache, toothache, and nahuhulog ang buhok. Ganun ba?
Yes po, Doktora.
Okay. Well, baka naman talagang ganun yon, and I'm sorry to hear that. Okay. Siguro let's take it. If you take it as a whole, parang if you ask me, stress yon. Okay? If you take it as a whole, I would say stress. If you wanna take it one by one, patingin po kayo sa dentist. Kasi baka naman yung toothache is causing, pag sira po yung ngipin nyo, sasakit ang ulo nyo talaga. And a toothache can become a headache. So yun po yun. With malalagas na buhok, let's do the first 2 muna and then tingnan po natin. Kasi baka naman you're so worried about the first 2 problems na stress na po kayo. So ayusin po natin yung maliliit and then balikan po natin si number 3. But you know what? The simple answer, pa-check up po kayo. It's hard to answer these kinds of things po on the internet. But I understand ang dami pong nangyayari and usually pag dumadami na po yung mga problems, stress could be a big part of it. But again, patingin na lang ho to be sure. Okay? Pasyensya na po and thanks for listening to us from Cagayan de Oro pa si Ma'am. Pasyensya na po, I cannot give a very concise answer kasi mahirap po talagang i-tease out yung problems from an internet question alone.
From Miss Margie Robles. Good PM po, Doc. Tanong lang po, bakit po ganon ang antibiotic na po? Anak ko may ubo pa rin siya at ano ba to? Halak. Ubo pa rin siya at halak. Matatapos na bukas ang antibiotic niya, ano po ba pwedeng gawin?
Mom, I can't answer that question also. Kasi I did not see the child the first time. I also don't know po the kind of antibiotic that you were given. My best advice to you, kung gumagrabe po, it's time for another consultation po sa doktor. Or talagang hindi po gumaling. Well, baka there are some antibiotics that don't work po, no? Or baka naman talagang viral, so wala naman po talaga antibiotics doon. What I could suggest, Mom, if it's getting worse, see the doctor again. And again, sometimes po, lalo na sa Zithromax, it's a 3-day antibiotic, ninenervous yung mga tao eh. Pero, what they don't know is that it remains in the blood for up to 5-7 days. So, sometimes nagwo-work pa rin siya kahit tapos na po ninyong inumin. So, you can give it time. Pero obviously, kung hindi po maganda yung kalagayan ng pasyente, it's time to go to the doctor. Okay? Few minutes lang po, I'll just close the windows at ako po ay inaano po ng niknik. Few seconds. Hi everyone, sorry for that. Pasensya na po, when you live in the province and you're outdoors, kasama na ho talaga yan. Okay? So come on, next.
From Miss Mirasol Bautista, morning po, Doktora. Pwede pong magtanong? May
Yes,
allergic
ma'am.
po, sinus rhinitis. Allergic rhinitis yata yung sinasabi niya, Doktor.
Sige po.
Pwede po ba ako magpa-vaccine? Natatakot po kasi ako.
From allergic rhinitis? Ma'am, mild lang yan. But your problem is not the allergic rhinitis. Ang problem nyo po, ma'am, talaga. First of all, it's not a serious illness, at least majority. Hindi ko naman minamaliit yung sakit nyo, no? But I would like to tell you that it's a very it's a very treatable illness, and dapat po I would suggest pa-check po kayo sa doktor nyo so that you can be treated. Ang concern ko lang po talaga, no, people with allergic rhinitis, sinus rhinitis, ang ano diyan talaga, tumutulo ang sipon niyan. So when you do the check up po dun sa bakuna, they will ask you talaga kung tumutulo ba yung sipon mo, inuubo ka ba, and you will have to answer yes. So most likely baka hindi ka talaga mabakunahan. So my best advice sa mga tao po, no, may chronic rhinitis, allergic rhinitis, sinus rhinitis, any form of rhinitis, pwede po kayo magpabakuna. Pwedeng-pwede. Ang problem po talaga, pag tumutulo po yung sipon nyo, hindi kayo babakunahan. So that's actually the bigger concern. Huwag po kayo matakot sa allergic rhinitis and bakuna. It's totally okay. Ang ano lang po talaga is kung talagang literal na tumutulo po yung sipon nyo, hindi ka mababakunahan. So what you should do is consult your doctor. Treat your allergic rhinitis po muna, sinus rhinitis or whatever forms of rhinitis that you would have po, para pag tinanong po kayo dun sa vaccination center, kayo po ay inuubo, sinisipon, may tumutulong sipon, ang sagot po talaga is wala. Okay? So, don't worry po about the vaccine and the rhinitis. That is okay. I'm just worried na, yun nga, as I mentioned, kung may aktibo po kayong simptomas, baka talaga pong hindi kayo mabakunahan. But if you can po, treat the rhinitis muna. There are gamots po for that, and then, diretsong bakuna na po. Okay? Also, guys, if you have allergic rhinitis, any form of rhinitis, it will be very difficult for you to go to work. Kasi yung screening sa work, talagang yung tanong is, inuubo ka ba at sinisipon? And at any form of office ngayon, kung merong sinisipon doon sa mga empleyado, mapapauwi po talaga kayo. So please get it treated, okay? Nagets mo ba yung sinasabi ko, Rains?
Doc, gets ko kasi I have a chronic allergic rhinitis.
Oo.
And siguro ako, kung share ko lang yung experience ko po. What I did is, I got a clearance from my doctor.
Oo.
I showed them my medication. And before ako pumunta doon, nagkaroon ako ng treatment like 2 days.
Oo, yeah, para hindi naman tumutulo yung sipon mo literal when you go there.
Yes po, ganun po ang nangyari. Inom po kayo ng antihistamine or whatever na i-recommend ng doctor.
Oo, yeah, I don't want kasi to tell you what you should drink eh. It should be your doctor to tell you po.
Okay, from one of our...
But don't worry, pwede po kayo mabakunahan. Okay, next question po.
Next question po, from Ms. Leonida Sadi. Second dose ko po kahapon. Di po ako nag-vaccine kasi daw po baka lalong mag-trigger yung pain. Mararamdaman kong iba-vaccine nila ako kaya po pinayuhan ako ni doktora. Doon na pumunta sa Nuero sa JBL. Parang hirap pong pumasok sa online consultation.
What is the problem? Sorry, ang haba ng tanong, hindi ko naintindihan yung question. Pasensya na po. What's the concern?
Doctor, actually, hindi ko din na-gets kung anong concern niya. Parang sinasabi niya po dito, second dose daw po niya dapat kahapon. Hindi daw po siya nagpa-vaccine kasi daw po baka lalo mag-trigger yung pain na nararamdaman niya. Kung iba-vaccine
Ma'am, ito na lang. Okay, ito na lang. Okay, I got it. Patingin niyo muna yung pain, ma'am, wherever it is, I do not know. Pero kung talaga pong nababahala kayo, you should not be vaccinated muna and have a check-up po for the pain. Okay? And then siguro, mabibigyan po kayo ng painkillers, ayusin niyo muna yun. With regards po dun sa online consultation ng JBL, marami naman po just give it a chance. Kung minsan po, there will come a time like maagang-maaga po o hapon na wala ng tao, baka huma-accommodate kayo. Okay? Kung hindi naman po, there are municipal health officers and rural health units po where you can go and have yourself checked up. Kung nakababahala po kayo sa pain, don't have a vaccine muna. Deal with the pain kasi ma'am, nakakaabala din po yun. And it might affect the way you, baka ho, how do I put it? Kung may nararamdaman po kayo and then you have a vaccine side effect, baka magsalubong po. So deal with the pain first.
Alright, sige po. For Miss Chris Bacalso, ano pong
Ay,
gamit?
wait lang. Yung mga nininervyos, you can have your second dose like 2 weeks. Okay lang ho yun, no? 1 month after. Pero wag nyo naman ugaliin yung delay. But a few days to take painkillers is totally okay. Okay? Wag po kayo manervyos. Sa iba talaga, oh my God, I missed the date. One day lang nagpapanik. Wag po, no? It's okay to get to, if you got sick, if you are in pain, kung kayo po ay nagkaroon ng allergic rhinitis, or na-ospital, it's okay to be slightly delayed. Wag naman yung 6 months, ano, pero it's okay. Sige, sorry to interrupt. Go.
For Miss Chris Bacalso, ano pong gamot sa paulit-ulit na kuliti ng bata?
Ay, ma'am, number 1, I'm not an ophthalmologist. And number 2, I'm not a pediatrician. Sana tinanong nyo ito nung nandito si Dr. Pauline Santiago last Sunday. Probably the best pediatric ophthalmologist po sa Pilipinas practicing today. Ma'am, I'm sorry. If you want, Dr. Pauline po does clinic at Philippine General Hospital. Pasyensya na po.
Okay, next question. From Miss Beverly Carmona. Hi po, Doktora. Kare-recover ko lang po sa COVID ngayon. Nahihirapan pa rin akong maglakad. Mag-iisang buwan na. Pwede na po ba po akong magpa-second dose sa COVID vaccine? Ang first vaccine ko ay August 26 pa.
First of all, Ma'am Beverly, I would like to congratulate you and lumaban din po kayo dun sa sakit. And I'm glad to hear that you're okay. I'm just a little worried about your being medyo weak pa rin ho, no? But it would be good na rin po kung kaya nyo na rin po and you think you're okay, it would be better for you to get the second dose na po. Kasi the longer that we wait, syempre may risk din po, no? Kung kaya nyo na po, please try to get the second dose. And a tip lang, no? Meron hong nag-alaga sa inyong doktor for the COVID. If you are worried, pa-clear na lang po kayo sa doktor na yon. That is really the best. Okay?
Miss Joanne Santos, hello po, Doktora. Ako po kasi madalas kong nararamdaman yung hilo at minsan nagbo-blurred na lang po bigla nakikita ko.
Oh my
Nagsisimula
God.
po sa
Okay.
Nagsisimula po siya sa tenga na pakiramdam ko po. Parang biglang may pumapasok na hangin sa tenga ko. At biglang akong hindi makakarinig. Mamaya lang po nun sa sakit na ulo ko at nahihilo na ako nun.
Okay, ma'am, I'm sorry to hear this first. Napakahirap po ng nahihilo. Truly. Ang dizziness is really a difficult sickness and illness and it's really quite debilitating. My question to you, ikaw ba ang nahihilo o nanghihina? Very good question. Kasi po wala po kayong sinabing umiikot na po yung kwarto. And that is usually po the classic description of panghihilo. Unfortunately, sa mga Pilipino po, no, lalo na sa because of the Filipino language, sa Ingles, dizziness is completely separate from weakness. Okay? Hindi nagsasama yun eh. But the way we use the Filipino language, yung biglang nanghina, biglang nahilo, ganun eh. So, I did not hear po from your description na umikot po yung kwarto. So, my best advice po sa ganito, number 1 po is best to have a check-up. Mahirap po kaming mag-comment to give you advice. So, the best advice for me, para sa inyo po, is to get a check-up, okay? Number 2, blood pressure, patingin nyo po. Number 3, blood sugar. These are usually the 2 main causes po talaga ng not feeling well, ng hihina, ganon. Ngayon ho, kung talaga pong hilo yon, umiikot po, no, ang kwarto, then you need to have your ears checked po talaga. Because you mentioned something na may pumapasok na air sa tenga. So, if it's really truly hilo po, patingin nyo po yung tenga nyo. Okay? And I do have a YouTube on dizziness or Meniere's disease. But if it is truly hilo, ma'am, wag po kayong magpanik. Kasi majority po ng hilo, though talagang nakakabahala, is not, may solusyon naman. Okay? I cannot say it's not serious kasi talagang people are really so sa hilo. But what I could best advise is check up po muna blood pressure, blood sugar, and then find out talaga yung tenga nyo po if talaga pong nahihilo kayo. And if they cannot find anything and talaga nagko-continue pa po, there will be further workups. Okay? So thanks for the question. Pasyensya na po, talaga ang Pilipino nasasama yung hilo sa hina. Ikaw, Reyna, do you notice that?
Yes, doktora, lalo na pagka nagka-clinical po ako duty, minsan sasabihin ng pasyente, para akong nahihilo. Hindi naman po sila nahihilo.
Oo, yung pala, nanghihina. Oo.
Nanghihina po. Meron naman, nanghihina ako. Yung pala, nahihilo na sila.
Oo. Parang sa Pilipino, nagsasama yun eh. Oo. Sa mga Kano, hindi. There is dizziness and there is weakness. So,
yes.
it's investigation po, ma'am. Investigation po ang kailangan dyan. Okay?
Okay, next po. Next question. Miss Kat? From Miss Ermina Cavero, Doktora, may allergy po ako. Asthma at laging hirap sa paghinga. Need ko po ba na magpa-vaccine? Nagtanong po ako sa isang doktora. Sorry. Sabi niya, ipagpaliban ko muna kasi baka di ko kayanin ang reaction. Ayun po.
Ma'am, my best advice to you, asthmatic and allergic, tama ba ako?
Yes po, Doktora.
Okay, so meron po kayong if you are an asthmatic person at may problema na po kayo sa baga, kasi ang asthma po may problema sa baga, it is very important po for you to get vaccinated. Kasi po, kung biglang nagka-COVID kayo, tapos sumama pa yung hika, it can be a very bad situation. So, very important po yon. With regards naman po doon sa allergies, rare lang po talaga yung mga allergic sa COVID. It is very, very, very rare. So, baka naman ito yung sinabi ng doktor, baka naman literal na hinihika ka nung pumunta ka doon. So, definitely, we need to control naman po yung asthma nyo. Kasi you cannot go naman ho to the COVID center na literal pong hinihika. So, ang advice ko po, and maybe, I don't know, wala po ako dun, but ang advice ko na lang po, ma'am, control first the hika. There are gamots po for hika, which are inhalers, inhaled steroids din po, and oral steroids. So, i-control niyo muna si hika, And then after that, get a clearance na po and pabakuna na. Kasi you really need to get vaccinated, ma'am. Kasi, natatakot siya, baka hindi mo makayanan yung side effects ng bakuna. Mas lalo pong hindi mo makakayanan yung side effects ng COVID mismo. So, it's very important. Ang interpretation ko doon, baka naman actively ka hinihika nung pumunta ka sa doktor. So, you take your asthma medications and then go to your bakuna na po. Okay? With regard to the allergy, don't worry. Meron naman hong nagbabantay doon in case you get an allergy.
From Miss Trisha Aquino, good evening po, Doktora. PLHIV po ako. Ask ko lang po kung ano po dapat kong gawin. I'm planning to go abroad po. Tatanungin po kaya sa airport yung ARV namin. Salamat po.
Ma'am, unfortunately, I am not an expert on the protocol po for HIV or ARVs, I also do not know the international protocol for this. Pero thank you for asking this question kasi po talaga matagal na po akong gustong siguro, let's alamin natin, Reyna, when is HIV Awareness Month. And then let's invite, kasi parang masyado tayo na-focus sa COVID. Pero there are other serious diseases that are still going around the Philippines. And definitely po, HIV is one of them. So, maganda po siguro ako, let's guest an HIV expert. Okay? So, I'm sorry, I cannot answer the question kasi ayoko rin magpanggap kung hindi ko naman po alam yung sagot.
Ako muna dito, Ate Rings. Okay, from Mr. Mark Tolentino. Doktora, sensya na po sa abala. Asko mo po, pwede pong mangutang if kareng vaccine nano po ing masanting. Sinovac, Pfizer, Moderna. Thanks po, Doktora. Yako po kasi dakal ko daramdaman, kaya po tatakot po inject. Gang visa ko po.
Okay, Sir Mark, thank you for this very honest question. And it's better to ask rather than to hide in your house and not get vaccinated. Eto po, I don't know also how old you are. Eto lang po, nabanggit niya Sinovac, Moderna, and Pfizer, okay? So they are all good vaccines. I got vaccinated po with Sinovac. I had zero side effects po talaga. And I'm very happy with Sinovac for myself. I like the old technology po of Sinovac, okay? Kung Pfizer and Moderna are also good, I also know people who've had Pfizer and Moderna, they have a slightly higher side effect profile po, no? Ang pinakamababang side effects talaga na nakita po sa Pilipinas is Sinovac. Pfizer and Moderna have higher incidence of side effects po. But they are also very good vaccines. So yun lang po, if you're really scared about side effects, Sinovac. Kung okay lang ho sa inyo lahat, then you can take all three. Okay? So yun lang po. Ako mismo, Sinovac. Husband, Astra. Pero I'd like to congratulate. Please go na. Kasi mas nakakatakot po pag magka-COVID kayo, imbes na yung side effects ang pag-iisipan po nila. And I would like to say, 25% to 30% na po ng Pilipinas ay bakunado na po. Wala naman ho tayo naririnig na nalibing bigla yung isang barangay because doon nag-vaccination program. Wala pong ganon, okay? Pero marami na po tayong kilala na namatay ng COVID.
Okay. From Miss Arlene Esquivel, hi po, Doktora. Ano po ang pinaka-characteristic po ng frozen shoulder? Pwede po ba yun na-confirm through x-ray ng shoulder?
Mamang alam ko po, and I'm not a rheumatologist or an orthopedic surgeon. Talagang extreme pain po that you cannot move your shoulder eh. I think it's a combination po of physical exam, titingnan din po naman nila ng x-ray, and then later on may physical therapy pong involved dyan. You know what, I have so many classmates who are some of the best orthopedic surgeons in Metro Manila. Kaya lang hindi pa ako nakaka-guess ng ortho. Baka panahon na rin.
Yes, okay. From Miss Lynn Mir Estrella Rodela. Good evening po, Doktora. Pasko lang po. Ano po magandang muna sa panginginig ng dalawang paa ko? At masakit po lagi ang batok po. At minsan malakas po ang heartbeat ko. Maraming salamat po and God bless po sa inyo.
Okay, this will be our last question kasi talagang kinakain na po ako ng nikniks dito. But can you repeat, nanginginig yung dalawang paa niya? What else?
Masakit po lagi yung batok niya at minsan po malakas po ang heartbeat niya.
Ang daming unrelated, okay? But thank you for asking this question. Sige po, isa-isahin na lang po natin, yung masakit, first of all, nanginginig ang paa. Usually, yung mga I don't know po, benign, usually most tremors are benign. Yung tinatawag po nating benign positional tremors. So, patingin nyo na lang po, maybe, you can try also taking vitamin B1, B6, and B12. I don't know po kung bakit nanginginig yung paa nyo. I'm thinking, check also your sugar kasi yung diabetes po plays a lot on the nerves. So sometimes baka kakaiba po yung pakiramdam nyo sa paa nyo. So check your sugar. Okay? Masakit ang batok, number 1 reason po yan for high BP. Not reason, number 1 symptom of high BP. Masakit ang batok. Please, pa-check nyo po yung BP nyo. So wala naman yung masama. Check your sugar, check your BP. And then malakas ang heartbeat. Wala naman pong just have an EKG siguro. Electrocardiogram po. Wala naman po talagang unless fast and uneven, then you need to have an electrocardiogram or an EKG. Yung malakas, wala naman po talagang malakas, but again, it cannot harm you to have an EKG to check. Ngayon po, you put your finger on your pulse dito po, kung it should be tadag, 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 tadag. Kung tadag, 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 tapos may malaking pause, then tadag, 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 tag, 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 tag. That is atrial fibrillation. Pa-check nyo po yung EKG. Pero yung pagiging malakas, wala naman po talagang specific about that. Pero para maging okay po yung pakiramdam nyo, then have yourself an EKG. Number 2 that I can tell you, sometimes people are complaining po na tumatakbo po yung puso nila. Please check your caffeine intake. Baka po marami. Or Coke or tea. Okay? So usually, when people complain about rhythm, malakas, I usually try to ask them to remove all caffeine muna. Okay? At saka yung energy drinks, my gosh, baka you are drinking po Red Bull, yung mga ganon, Vim, yung mga ganyan. Marami pong ano yan, ang magpapabilis po yan at pagpalakas ng tibok ng puso. I don't know if you're a guy, but a lot of guys drink that and then suddenly gumaganon po. Okay?
That's all, Doktora.
Everyone, thank you so much. Ingat po.